Let me introduce briefly about myself. I'm Dr. Vijay Bhangale. I'm Associate Dean at IS Management College, Mumbai. So how do we exactly go about doing this? So I believe there are three main stages to go about leveraging technology and collaborating when it comes to all these technological devices. First is we need to first be very clear about the patient journey. Second, once having identified the patient journey, you need to identify the gap. So identify a gap, whether it exists between the information requirement, the content requirement for the healthcare professional. Because I also get to know that after this lockdown, there have been so many pharma companies going ahead with webinars that the doctors were irritated. Many of them complained about many invites for the webinars and were not happy about the things happening. So therefore, it's very critical to, rather than just following the herd, identify the need, identify the gap. And once you have identified the gap, then choose the right channel through which you can get across to doctors or the other doctors or patients or even chemists or stockists. I'm going to talk about these three things in the subsequent slides. So if you talk about tracking patient journey, so this is just an example for you to show how does the tracking of patient journey takes place. So if you see about a simple thing like vaccination, the journey starts with the vaccination program being informed in schools. And therefore the kids in the schools get to know about vaccination program. So that's the first stage, which is awareness. Once the kids become aware about this vaccination program, they in turn inform their parents. So which is where the engagement with the citizens starts. Sorry. And then after the engagement with the citizen is there, the parents and obviously the citizens further try to get more information on this. So that's where comes the third stage, which is readiness. And once the citizen or the informed citizen is ready, then he tries to seek opinion of his family physician. So there is discussion with healthcare practitioners. So healthcare HCP consultation. So typically with your family physician, you talk about the vaccination. And once it is clear that this is important, critical, you need to do it, then it's a fulfillment. That is where you go ahead with vaccination. And finally, after you are done with it, it's where the adherence to the typical regimen, and not just adherence, also advocacy. You further adhere to it and advocate or recommend it to your friends and family members. So this is what a typical customer or the patient journey is. So what I suggest is you need to identify the patient journey or the customer journey for your each individual brand or product. And this is extremely important. The more accurately you will be able to identify this, the better would be in a position to develop your strategies.